Hi, my name is Jocelyn Alexander, and my topic is helping the homeless with job employment. Did you know 10% of Richmond County's population are homeless? There are about 8 to 10 shelters run by the county and city supporting homelessness in different ways. Today, I'm here to discuss homelessness and the lack of employment resources. I was very appreciative to interview with the director of GRIP, Catherine Sullivan. She stated that it's actually a myth that all people who are homeless don't have a job. Some actually do. Due to COVID-19 pandemic, it's likely impossible for a homeless person to get a job. Health regulations have increased, and since many things aren't the same, one cannot qualify for jobs. My proposal is to start a program that outreaches to homeless communities in Richmond about job preparedness. This program is called Assisting Career Evolution Services, aka ACES. ACES consists of helping constituents with job interviews, resumes, personal finances, holding a mailbox center, and working with shelters to provide more to individuals. We would get to know people of the community to volunteer and provide their knowledge of different resources. I would also like to use social media to connect with people with other organizations like GRIP and Bay Area Rescue Mission to help gain attention to this program across the county. People can go to the social media page of ACES to learn why their help is vital to the success of the community. My solution is innovative because I want to bring people together who are experiencing unfortunate circumstances to uplift each other by encouraging security in their lives. I was glad to hold an interview with Jamie Jeanette, who works for Health, Housing, and Career in Homeless Division, which also supports Continuum of Care. She brought to my attention HUD, a council that does most of the funding and prioritizes who needs funding mainly. One way for me to start my program is to work with the Council for HUD through connections like Ms. Jeanette, gaining federal grants to distribute to this program. I want the outcome of this program to reduce the amount of homeless people without employment in Contra Costa. I want the people to know they're cared for, give them a positive mindset, and their needs are important to making the community a promising place to thrive. Thank you.
Hello, everyone. My name is Leo Villalobos, and my topic is healthcare access for undocumented immigrants in California. Okay, so California is actually home to almost 11 million immigrants, which is pretty surprising to me. While 95% of US-born residents in California have health insurance coverage, only 86% of immigrants do. This problem is occurring because of immigration laws, language barriers, and financial situations. Healthcare should be a basic human right, in my opinion. The people we typically consider unnecessary are actually very necessary, as they do many essential jobs. We're not providing them with the essential health services that they require. My solution for prevention is placing clinics strategically near a heavy population of immigrants, such as these 5 California counties: Santa Clara, San Francisco, San Mateo, Los Angeles, and Alameda. To make it easier for them to receive services, we will have official partnerships with medical schools or colleges to build a bridge between students who need experience and the people who need medical services. My solution is different because the schools will have to require the students to work for free in order to graduate. This is a win-win situation for everyone. It not only gives students a chance to practice their skills, but it also creates a culture of awareness about the health inequality of the undocumented population and among future clinicians. The clinic will also host fundraisers to make a profit and have suggested small donations to pay for important equipment. Schools can also donate equipment. It's an innovative solution because through this program, students will be able to earn required credits necessary for graduating in the medical field and help the small clinic with free labor. We would make sure the population's needs are heard and met by having personnel that can relate, listen, speak the language, and be compassionate. We will also have assessments for treated patients to ensure that they have received the help that they needed. In conclusion, providing medical services to undocumented immigrants can help not only the community, but also the medical students who are practicing their skills. I believe this is important because healthcare should be a basic human right. Thank you for your time.
Hello, my name is Giovanna Arriaga, and my title for this project is More Latinos in the Health Field. And the issue is the lack of representation of Latinx people in the health field. In the year 2019, there were less than 6% of doctors in the state of California. They were from the Latinx people. And if this percentage keeps being this low, the patient care will be worsened in the Latinx community. Keeping in mind that the Latinx population in the state of California is growing. Due to this low percentage of Latinx doctors and other healthcare workers, creating a program about health in the Latinx communities, as well as having more resources, will increase this percentage. The root cause of this issue is that in most Latinx communities, there are not many resources or information about college and a lot less information about working in the health field. Not having these resources in Latinx communities is unfair because everyone should be able to be exposed to different kinds of resources so they could be able to succeed in a career. To address this solution, I would like to propose a program where it would start in middle school and be extending it through high school. In the beginning, I would like to be established in the Mount Diablo Unified School District. This program would be after school, where the students who have an interest or want to start to explore more about the health field will be taught by a curriculum. It would also provide resources and information about different scholarships, how to apply to scholarships, about college, and what it would be like a guide for them. There will also be speakers such as doctors and nurses and other health field professions. For the students to feel connected with these speakers, I would like them to be from the same cultural or from the same community. My solution is innovative because although there is a program called the Health Academy in high school, it is only 3 years, and it would be more beneficial for students to start exploring at an early age. Institutions will be changed because middle schools in the Mount Diablo district don't have this type of program. If this program is successful, the result will be that more and more Latinx people would be interested and want to be part of the health field. It would also lead to an improvement of patient care in the Latinx community. Thank you.
And my project for this summer was basically formed on the foster care system. And the reason why I picked that is because I feel like a lot of children, they get pulled away from their families at a very young age. Whether it's not their fault, it's mainly because many parents cannot provide for them or cannot give them the life that they deserve. But during that process of them being in the foster care, they're continually moving from house to house, to family. And I feel like that right there is a lot of abuse for a child to go through emotionally and mentally. And I feel like not only does that make an impact on their life, but it also makes an impact on their education and where they're going to go after they either graduate high school. And the main reason most kids do go into foster care is because of child abuse. And once the foster care children do age out, which is between 18 and 21, 1 in 5 will become homeless because they do not have a job, or they did not graduate high school, or they did not get a good degree. And many in that situation, many kids do not have a good stable home to be in to do their homework or study, and that makes a big impact on their future, depending on what their grades are in school, to seeing what kind of college they can get into. Over 400,000 children are taken away from their families because they cannot provide for them. and 30,000 youth age out of the foster system after they turn 18 to 21, and that is because they were either too old to be in the foster care system or they did not get adopted by the family that they were staying at. And then 70% after they age out will be on government assistance, and 25% will not have finished high school. And I feel like not finishing high school for a lot of kids that I see for myself is that they probably did not have someone to check in on them, to see their grades and to go over homework with them. And I feel like that really makes an impact on them, because they feel like if they couldn't finish high school, then they can't really do college. And that's kind of sad, because like that's our next generation, and I want to see the next generation strive in life and, you know, go to college, get a degree and get a great job. But some people, they just don't like school, and that's fine. But also having someone to help them navigate what their interests are and what they would like to pursue in life after getting out of the foster care system. And then I feel like many people stereotype foster care teens as being troubled because a lot of things that they've gone through, that's how they're going to act, that's how they're going to react. And I feel like people, they definitely judge foster care youth, and many people don't want to adopt teens, especially teens, because they are troubled and they make a lot of wrong decisions. But that's because they didn't have that help, the extra help from a parent, and they don't have a good path to lead on. And it's actually depending on what state you're in. Not all states provide financial aid, or all states do not provide government assistance once they reach 21 for housing and school and like allowance. Not all states do that, but we are lucky that United States, they do fund for government assisting and for housing and stuff like that. So, yeah.
Hello everyone, my name is Kayla Merino. My presentation is on what programs do veterans want when they return home from deployment. So my presentation is mainly focusing on the lack of resources available to veterans in my home state of California. So what's unfair for veterans is they risk their lives for our country, and when they return home, it's often hard for them to adjust back to civilian life. And with so many programs out there, it often causes them a lot of stress because they're so confused on which ones that are going to benefit them the most. So what I want to do is set up like 3 programs, one for medical, one for housing, one for finding jobs, that are just starting the basis of like creating programs that are easier for them to understand, rather than having all the ones out there that start causing stress. Because what I want to avoid is losing, what my main focus was trying to help and understand why so many veterans commit suicide because of post-traumatic stress disorder, because the statistics for that, I found data that in 2005, it showed an average of 15.9 veterans taking their own lives, but then it spiked again in 2017 to 16.8 daily. So I just wanted to start the program. So to make medical services easier to understand, I would use funds created by the government to make more treatment centers in the state of California, as we have such a large population. And from data I found from September 30th, 2017, there are only 30 veteran centers for the whole state of California, and there weren't for up north, there wasn't as many as there were for like more populated areas, but there is veterans throughout the whole state. So I want to make veteran centers that are like more spread out. And I also want to make more inpatient care sites and outpatient care sites, because there's only 9 inpatient care sites as of 2017 in the state of California, and only 62 outpatient care sites. And that's such a low number for how many veterans are located in the state of California. And then to help them get jobs, I would get funds to make job centers, where there could be job postings and job coaches and volunteers to help them do things like mock interviews and resume writing, because when they get back home, they're not really sure like where to go looking for jobs, and many of them go into services after right out of high school, so they don't have resumes, so they need help in that field. And lastly, to make housing more affordable, use the government funding to create veteran housing communities where they could pay for rent, but they would only be paying enough so they can still survive for their families for food and utilities. And my solution is innovative, as these programs are going to be chosen for the veterans what they believe are in their area is needed. So like doing surveys and interviewing veterans to do what they truly think their area needs, because some areas may need more veteran centers or some may need more medical help or housing depending on where they are. So my potential barriers is relying on government funding for such a large program in itself will be a huge barrier, because we're trying to create centers and like medical centers and job centers and housing. So having all of that, it's going to be a large project, and we also have to pay the workers who are doing it. And another large barrier is this is just laying out the foundations for these three big things, so they're all easier to understand for the veterans. So it's going to need more money as the times change, because the cost of land is so high and cost of creating homes. And the large barriers is just laying out the foundations for the programs. That when things change, it's obviously going to cost more money if you need more centers. And so thank you for listening to my programs. I wanted to help create the programs I wanted to create to end this back and things such as veterans ending their own lives due to lack of medical centers and lack of resources for not only them, but also their families.
Hello everyone, my name is Vanessa Sida, and my title for this project is Immigrant Medical Access is Slight, Now There's a Class to Make It Right. So, did you know that 45% of undocumented immigrants and 23% of lawful immigrants are uninsured, compared to the incredibly low amount of only 9% of US citizens uninsured? These immigrants not only have the troubles of paying for medical treatment, but they fear deportation as well. This fear of deportation drives them away from healthcare, as undocumented immigrants only account for 1.4% of medical expenditures. This is the lowest amongst any other group in the United States, meaning there are not many medical options to keep these immigrants safe and healthy. Even though their circumstances may be different, everyone in this country should still have fair access to healthcare. In the United States, currently there are only about 300 safety net hospitals and about 1,400 non-emergency clinics where immigrants are able to seek medical attention. However, this is far from enough. With my solution, we will maximize these across the country while implementing a class into middle school and high school health curriculum courses. This class will inform students that the immigrant population is welcome in these facilities. The educators will explain some of the medical practices available and demonstrate that there will be a no questions asked policy to the immigrant population. After the class is educated, the youth can address what they have learned to their immigrant families and explain that it will be okay to turn to these facilities. Considering that immigrant families tend to rely on their children for information, this news will allow more immigrants to feel safer to attend these medical practices. With this, we will begin to see a decrease of fear of deportation and an increase in seeking medical attention. These results will continue to thrive as after the care is given, we will provide surveys asking for feedback from the immigrants because it is important for their voices to be heard. The solution will encourage healthcare for all and spread more knowledge about what discrimination is and how to control it. Immigrants absolutely deserve better access to healthcare in order to improve their quality of life. Thank you.
Hi, my name is Liliana Landa, and my focus for my project is health equity in the healthcare. What does health equity mean? Health equity means every individual is provided with full and equal access to ensure a healthy lifestyle. Unfortunately, during times like this, when health is a major factor in life, is when many individuals start to notice the racial inequity in healthcare. Injustice in healthcare comes from implicit biases that were influenced by the experiences of healthcare workers and everyone else's society. Due to these attitudes, when patients of color go into a medical institution, they are not treated as a top priority. Multiple times, people of color had gone to the hospital in pain only to be told that their pain isn't severe enough to treat and they are sent home to possibly die. In addition, African Americans are 15 times more likely to believe they would receive better health care if they were a different race than whites. Latinos express the same sentiments 13 times and Asian American 11 times more than whites. To put this problem to an end, I urge healthcare institutions to create an anonymous digital survey about bias that is given to random patients that were admitted to the hospital. The survey would include several questions to get the patient's feedback about the treatment they received from the doctors to the front desk. Once the survey is complete and sent back, the feedback will be analyzed and filed. If there are any reports of staff members with bad reviews from patients, there will be an investigation, including a brief educational class that is mandatory to complete. Following the investigation, if punishment is needed, the staff member will get its first strike along with racial awareness and proper patient care classes. After 3 strikes, the employee will be let go. By identifying the racial discrimination in medical institutions, we are ensuring every individual with equal access to health care.
Did you know that here in California, over 7,917 youths were in juvenile detention, and that the ACLU reports that youths of color to white youths in custody is almost at a 3-to-1 ratio? Hi, my name is Michelle, and I'm here to talk about how one simple action can reduce our youth incarceration rate here in Contra Costa County, and at the same time bring up our attendance in high schools by 21%. And that simple action is defending the police and using the funds to create ethnic studies and anti-racism curriculum at high schools. Stanford researchers found that attendance increased by 21% for those who took an ethnic study class. This will benefit the target population, who are students of color, but also everyone else. Ideally, the teacher would be a person of color and not only be a representative, but also to have a cultural and personal connection. The reason the school to prison pipeline is an issue is that students are much less likely to succeed in school when they are in the grip of the juvenile justice system. The stress of having law enforcement at schools makes students not want to go to school, but defunding the police and having ethnic study classes can reverse it. By removing the stressor and replacing it, the school will have better attendance. My solution is different because within the ethnic studies, we are also teaching anti-racism and courses for staffs, so that way everyone is on the same page and is aware of their biases. Our youth incarceration rates here in California are absolutely intolerable at nearly 300 per 100,000 youths, in jail at a rate of 3-to-1 youth of color to white youth. This cannot be allowed to continue.
Hi, my name is Ashley Rose Lising. My pronouns are she and they, and the title of my social issue is The Awareness of Sexualization, Objectification of Women and Young Girls. The first question you may ask is, what's sexualization? Individuals may regard this as being seen as sex objects or evaluated terms in physical characteristics. Sexualization and objectification is represented in multiple parts of our lives, including media and school. Did you know that 51.8% of advertisements that feature women portray them as sex objects and have 10 times more hypersexualized images of women than men? But we don't realize that we all take part within sexualization/objectification. This occurs because of the set views and perspectives that have been built upon representation within the media, which essentially carries through the generations through our culture. From years of television, women have been portrayed as domestic figures and passive to men, portraying them as sex figures. This manifests from the ideology that women are inferior, creating stigmas. As students are exposed to societal norms, especially due to the growth of technology and exposure to social platforms at such a young age, without the proper guidance within these terms, we tend to play into the roles of toxicity, such as gender roles and stereotypes. The education system also plays a role when they implement dress codes that bar girls from self-expression through clothing, deeming it too revealing or distracting when they say the midriff or shoulders. This is also an example of hypersexualization. This can actually lead to rape culture, victim blaming, and ongoing stereotypes when it's perpetuated in societal and cultural expectations within the sexes. Targeting kids between the ages of 12 to 18, preferably starting in middle school, will help implement my solution of expanding the sex education system program to involve topics like objectification, rape culture, etc., because these actually can take a toll within someone's sex experiences and how it can actually affect them mentally as well. This is essentially killing 2 birds with 1 stone. The earlier we plant this seed within the students in middle school, we break barriers of these topics being taboo and weird. This allows growth in knowledge and breaking the societal and cultural normalities of being uninformed. This program will grow within the students, just like sex education within high school. Doing regular monthly check-ins with students and teachers will keep them engrossed. Helping students gain this knowledge will break the barriers, and future CEOs will drive them to be better and break these perpetuated expectations made on women. If my solution is implemented, we will slowly become more conscious of the impacts of these normalities, breaking barriers into multiple aspects of life. Thank you.
Perfect. 0 interruptions. That worked perfectly. Okay, I would love to hear from 2 of our judges, or 2 questions and 1 comment, however we want to structure it.
I have a question. Well, first, thank you so much for your great presentation. Ashley, how do you see yourself continuing to talk about this issue that's so important in the future?
Personally, I see myself as pushing this idea for more in the future is constantly educating myself, as well as using my social platform to advocate about this certain topic, because it's been a great idea where we see people ignoring this idea. So just constantly being able to inform your friends if they make a certain comment, and just educating them will benefit not only yourself, but everyone else around me. So, yeah.
My title is Insight Senior Inclusion. My name is Jesus Castañeda. So, love is forsaken for the elderly, and how I reached that conclusion was hard to pinpoint tangibly. But there wasn't denying that there was prevalent acts to deem differentially abled people useless, like in government, in architecture, in tone, when people speak in pity, in media, in nursing homes, in shelter homes, in care facilities, in programs, in job occupations and openings, and the inferences are interminable. So, but however, I couldn't find the specific statistics to back up the claim directly, either because everyone denies them being neglectful to their parents and the universal myopia in media. So we can use COVID as an example, and the interpersonal accounts of every marginalized group, including senior citizens. So everyone's stories are emotionally worth more than 2 minutes worth explaining. So with the solution, what I want is to rid the agony of neglected senior citizens who aren't acknowledged as human beings or catered that way. And what I want is kind of this program where you would have seniors who are typically more spiritual, where the teens are not, but they also need that, they kind of need that attention, and rid the external expectation of being a dollar sign, or like having, like not everyone's fortunate to have that wisdom that a senior would have, and a senior wouldn't have the attention that a youth would have into moving forward in the future. So this would be self-government. It'd be laissez-faire leadership style. So it's governed by the people participating in it mainly, and me and my team would step in rarely, but just to get the technicals and the technology to work for it. As of right now, the technicals of the pedagogy is not keen. It's not there yet. The target population is neither exact because the values are not static in every place in the country, but in general, it's youth and senior citizens more susceptible to faulty foresight and the cynicism of economy-craved Western worlds. So we can filter specifically to the city if we want, and filter specifics like unkept senior homes, those with bad ratings, and desolate neighborhoods, which is like colored neighborhoods.
Hello, my name is Anthony Jacobo. The issue I decided to focus on was the inequities within climate change and how some are affecting more than others. So the title of my solution was A Step Towards a Better Tomorrow. From living our day-to-day lives to big corporations, we all emit greenhouse gases into the atmosphere, ultimately increasing the rate of climate change and affecting those most vulnerable, which are low-income communities. are the greenhouse gas emissions released by everyday human activity. Weather becomes more severe, from rising temperatures to rising sea levels, which once again impact those at the bottom. In Contra Costa County alone, about 14.3% of the population live under the line of poverty. These families are the ones directly suffering by the impacts of climate change, leaving them most vulnerable to chronic respiratory illnesses, increased cancer rates, and much more. People of all ages living in low-income communities are those whose rights to live a long, healthy life are being threatened because of the actions of others and the lack of resources presented within these communities. Climate change inequitably impacts low-income communities due to the severe weather change, ultimately creating economic disruption. From climate and weather changes such as rising temperatures, low-income families often have to face economic disruption, which not only affects their ability to obtain medical attention, but also leaves them in economic resiliency. A solution to putting a stop to these barriers and inequities that are affecting the 14.3% of the population living in Contra Costa is by creating an organization which will uplift the voices of the unheard, in this case, low-income communities. In order for this organization to thrive, I will first focus on providing solar panels to low-income families. By providing solar panels to these families, they will not only be able to reduce greenhouse gas emissions in the air, such as carbon dioxide, but they will also be able to save money by reducing their electricity bill. This money can then be used so they can invest in something else of their necessities, such as medical treatment. This organization, as compared to others in Contra Costa, is much better because it focuses on tackling the inequity and injustices head on in order to take a step in creating a better tomorrow for all. Although oftentimes the majority of low-income families live in apartments or rented houses, the organization has also created alternatives to help low-income families who live in rented spaces. These alternatives include offering small solar panels in which can be placed outside windows, and the organization will also focus on talking to landlords to be able to provide these solar panels to the low-income families renting the space. Other than providing solar panels, this organization will also focus on educating the general public on the inequities present within climate change and how they themselves can take action to reduce their own carbon footprint to close this inequity gap. With this organization at hand, together we will be able to take on the fight to create a better tomorrow for low-income families and also give them the opportunity to live a long, healthy life.
Joleena Rose Mercado, and I go by she, her, hers. And my topic is mental health awareness in high schools. I can't stress this enough. High schools in the Contra Costa County of the Bay Area should bring awareness to the mental health issues of their students. We are all victims of society in some shape or form, but no one ever seems to talk about it. For the sake of our brothers and sisters, it must be said that our mental health matters just as much as our physical health. According to the National Alliances on Mental Health, 1 in 5 youths ages 13 to 18 live with mental health issues, and about 75% of them develop them before the age of 24. WHO's findings show that women are more affected by depression than men due to the fact that women reach puberty first and their production of serotonin is affected. This is not a widely known fact, but knowing why can cause the stigma of women and mental health to be lessened, since it is more clear that women tend to be more affected. Mental health issues can be genetic, meaning that some people are predisposed to it more than others. Mental health issues can also be influenced by societal norms placed on the youth, whether it's conforming to their gender roles or excelling in school to fit in. This makes it harder for students to understand that mental health is more common than we think, but we are not alone. Surveys can be issued to high school students to assess how they are feeling mentally and what they would like to see in their schools in order for them to participate in. Based on the information given by the high school students, an elective class for mental health and how to cope with stress will be implemented. As a result, students can come to terms with their feelings and learn to better care for themselves and their peers. An online course will also be offered for those who don't feel comfortable sharing their personal feelings in a classroom. Psychologists and psychiatrists can teach students about the effects of mental health and its importance of staying healthy, while also being given medication if the student wishes. Guest speakers are also invited to the class to share their experiences with mental health and spread light on what they did to overcome it. Drop boxes to school administrations are also encouraged for students to leave feedback on mental health classes and to make the class more fit for their needs. With students given the opportunity to learn more about themselves and showcase their voice and experiences that they hope to understand, they will be able to build a stronger bond with their peers as well as themselves. Not only will women have their stigmas to mental health be brought to light, but everyone will also have the chance to learn how to cope with the obstacles that hinder them from success. Students will be able to deal with the struggles of who they are a little bit easier as they transition into the next chapter of their lives.